Hello, this is Dr. André Jones with Inspire Dental, and today we're going to dive further into the topic of cavities. I know we had one video previously that kind of introduced the topic and answered several questions, but we have more questions coming in. So here we are with a second video to dive into more of those frequently asked questions regarding cavities. So just a recap, in our last video, the question we answered was, well, what is a tooth cavity? So in case you didn't see that video, a tooth cavity is where a bacteria in our mouth has started to rot away and decay a part of the tooth. On top of that, a cavity can also be formed by, part of the tooth breaking. If you think of the actual definition of the word cavity, so a cavity is kind of a generic term used to describe tooth decay or a fractured piece of the tooth that ends up leaving a hole in the tooth. So last video we dived into what causes cavities. And a very common misconception and question I get is toothbrushing the only way that we get a cavity? And in short, the answer is no. I actually have lots of people who are like really good at brushing their teeth and still have cavities. So a second part of, that goes along with brushing is going to be flossing. Flossing helps loosen up food and bacteria in between the teeth, and brushing is used to brush them away. So if we don't accompany flossing to some degree with our toothbrushing, well then we're going to still prone to getting cavities. Also, what is our technique of brushing? Are we using the right technique? Are we using the right type of toothpaste? So there are very specific techniques used, and so a lot of times people will saw back and forth, and you actually want to create circles when you're brushing. So imagine you're scrubbing every tooth, making a circle, and it's not the power in which you scrub, but really just the technique, and then using the toothbrush long enough to clean the tooth. And so other ways that can create cavities too is our diet. If we're eating lots of things that are going to weaken the teeth, no matter how much we brush or floss, it's going to weaken our teeth. We're going to be prone to cavities. There's also medical conditions that can create cavities or promote cavities. So diabetes, for example, when someone has uncontrolled diabetes, our saliva will actually contain sugar in it. Well, like we talked about before, sugar feeds the bacteria, which then creates a cavity. So even diet can, contribute or promote cavities. And lastly, if we have a lot of acid, so either we throw up a lot or we have acid reflux that comes up, that acid coats our teeth and starts to weaken the teeth. And bacteria do a great job of thriving in an acidic environment. So even acids and things like that enter our mouth can weaken the teeth and create cavities. How worried should I be about a cavity or if I have one? And what I tell patients is, the best time to treat a cavity is one, when it's spotted, and two, it's not hurting. Because very often I'll show someone like, hey, you got this cavity in your tooth. And the question I get asked is, well, hey, it's not hurting. Do I have to treat it? If it's not hurting, that is a good sign, because that means it's still small. By the time it's starting to hurt, that means it has progressed, and there's a very high likelihood that you're going to need a root canal, a crown, or maybe even need the tooth pulled out. And there was times where I've seen teeth decayed all the way through and have no pain at all. And so the best time to treat a cavity is not when it's hurting, but actually is before that time comes. So that is the best time to treat a cavity. I waited too long. Is it too late now because it's hurting to treat this? Answer is no. The moment it starts to hurt, then, like I said, it might need more advanced treatment. But the best thing is to come in and assess to see where it's at, and hopefully we can get it still at a point where it can be treated and the tooth can be saved and not have to be pulled. How do we treat cavities? There's many ways to treat a cavity. At its smallest level, the way you treat it is actually with an agent that actually heals and repairs the tooth itself. That's called remineralization. And that's done when we have a really, really small cavity. As the cavity starts to grow and now it's more medium to large, then those often can be treated with a filling, and sometimes we have to add a protective layer so that the tooth is not sensitive after the cavity. Now, as we move into the larger category, then we're running the risk of needing a root canal or needing a crown to treat that cavity. So like I was mentioning, as things start to grow, the more advanced treatment is going to be needed. Now, what is important to note too, there does come a time where the tooth has had so much decay, the cavity is so big, where it's not restorable anymore. When it's not restorable, then at that point we're talking about pulling the tooth and then treating you with like a bridge a partial, or an implant. And so those would be the kind of like the life patterns of a tooth and kind of what the treatments are recommended at the size of cavity. Say we got to this cavity, we treated it, it's done. Now that I have it filled, am I done? Is it possible for it to come back? And the answer is it is possible for it to come back. A lot of people think it's one and done. And it's like, no, the very thing that caused the cavity to form in the beginning is the very thing that can continue that cavity to form. Because if that cavity, if we got one before, that means filling is man-made. When it's put into the tooth, it has a seal. Well, if we are not keeping clean our mouth, that seal breaks down over time. So if you actually look at the average life of a filling is about 7 years. The average life about a crown, 10 years. Well, why is that the case? The number one reason me as a dentist have to replace old fillings or old crowns is because of new decay. It's not because something breaks down. It's almost always because there's a new cavity. It is important to know that if you had a filling, you had some type of restoration place, you got to keep it really clean to prevent further decay from coming back. The most important thing is, now that we know cavities can come back, is, well, we prevent. How do we prevent? You come in for your normal routine cleanings and exams. Also, if you have any suspicion, you start to see discoloration, things feel a little sensitive, come in right away. But as far as our prevention methods go, brushing and flossing, twice a day is going to be your number one thing. Now, the best way to brush your teeth is with an electric toothbrush. The best way to floss your teeth is actually with a water flosser. Those are the ways that research proves that are most effective. And then, of course, using the right type of toothpaste, using the right type of mouthwashes, and there's even things like probiotics that we have nowadays to promote good bacteria in the mouth, and that way you're less likely to develop gum disease or tooth decay and things like that. So those would be our ways that we prevent cavities, is all through hygiene and normal preventative dentistry. What is the best way, if we think this is happening, to get in? It's to schedule an appointment. And we are always accepting new patients in our office. We never turn anyone away. The best thing you can do is just give our office a call. Our office number is 210-734-5092. So we want to get you in, we want to see you, and we want to get that problem, that concern addressed immediately. And so that would be the best way to get scheduled, is to call our office. You can also go to our website, which is inspireddentalsa.com. And on our website, there's a form where you can also submit to get an appointment. So that is going to be the best way to get onto the schedule to have this problem addressed. So I hope I further answered some questions or filled in a little bit of gaps that maybe our last video didn't answer. The best thing to do, like I said, is to come in, get an appointment, and be checked routinely. When you're checked routinely and you keep up with that, then there's less likely for things to develop, or if they are developing, we get them while they're small. So I hope this video was informative. I look so forward to hearing from you and seeing you in our practice. Again, our office number is 210-734-5092, or you can check us out on our website, inspireddentalsa.com. Look forward to seeing you soon. Thanks. Bye-bye.